I want to tell you something that took me nearly 30 years of practicing medicine to fully understand, and it has to do with a question that almost nobody asks their doctor when they reach a certain age. It is not about which tests you should take or which medications you should be on. It is about something far more important, something that can change the entire trajectory of your health in the years ahead. Most people walk into their doctor's office after turning 70, and they assume that more testing is always better, that every screening available should be done, that catching everything early is the only path to living longer. But after watching thousands of patients navigate these years, after seeing what actually helps people thrive and what simply creates fear and confusion, I began to notice something that changed how I practice medicine entirely. The question you should be asking is not what tests are available, but rather which tests will actually change what you do, which results will lead to actions that improve your life, and which ones might simply fill your mind with worry without offering any real benefit at your stage of life. Let me be very clear about something right from the start. I am not telling you to avoid medical care or to stop listening to your doctor. What I am saying is that the conversation about testing after 70 needs to be far more nuanced than it usually is, and you have every right to be part of that conversation. You have the right to ask why a test is being recommended, what will be done with the results, how those results might change your treatment, and whether the potential benefits outweigh the risks and discomfort. These are not difficult questions, but they are questions that most people never think to ask because we have been taught to simply trust and follow along. And while trust is important, so is understanding. You deserve to know why something is being done to your body. I remember a patient I saw many years ago, a woman in her mid-70s who came to me after having a battery of tests ordered by another physician. She had blood work, scans, stress tests, and several imaging studies done over the course of just a few months. When I asked her why all of this had been ordered, she looked at me with genuine confusion and said she did not know, that her doctor had simply told her it was time. None of the tests had revealed anything alarming, but she had spent weeks worrying about each one, losing sleep before the appointments, and then feeling a strange emptiness afterward when everything came back normal. She told me she felt like she was waiting for something terrible to be found, and that feeling had begun to dominate her life. This is what I mean when I say that testing without purpose can do harm. Not physical harm necessarily, though that can happen too, but emotional and psychological harm that wears you down in ways that are hard to measure. The reality is that as we age, our bodies change, and those changes show up on tests. Your cholesterol might be higher than it was 20 years ago. Your blood sugar might creep up slightly. You might have some calcium deposits in your arteries or some wear and tear in your joints that shows up on an X-ray. And here is the thing that nobody seems to talk about enough. Many of these findings are normal parts of aging. They do not always require aggressive treatment. They do not always predict disaster. Sometimes they are just signs that you are 70 or 75 or 80 years old and your body has lived a long life. The question is not whether these changes exist, but whether addressing them will actually help you live better or longer, and that is where the conversation needs to happen. I have seen people put on medications because of test results that fell just outside of a normal range, medications that caused side effects, that interacted with other drugs they were taking, that made them feel worse instead of better. And when I asked whether the medication was truly necessary, whether it was preventing something specific or simply treating a number on a lab report, the answer was not always clear. This is not to say that treatment is never needed. Of course it is. But treatment should be based on your whole picture, on your symptoms, your history, your other conditions, your goals for your health, not just on a single number that crossed a threshold on a chart designed for a much younger population. Think about cancer screenings for a moment. There are guidelines that suggest certain screenings should continue into your 70s and beyond, and in some cases that makes perfect sense. But those guidelines are general, and you are not a general case. You are a specific person with a specific body and a specific life expectancy and a specific set of other health concerns. If you have advanced heart disease or severe lung problems or other conditions that are likely to affect your lifespan more immediately, then finding a very slow-growing cancer through a screening test might not actually help you. It might lead to biopsies, to surgeries, to treatments that are hard on your body, all to address something that was never going to cause you harm in the time you have left. And I know that sounds harsh, but it is the truth that needs to be spoken more often in medicine. Not every finding needs to be treated. Not every abnormality needs to be pursued. Sometimes the kindest and wisest choice is to leave well enough alone. I am not suggesting that you stop all testing or that you ignore symptoms. What I am suggesting is that you have a different kind of conversation with your doctor. Ask what the test is looking for. Ask what will happen if something is found. Ask whether you are healthy enough to undergo treatment if something does turn up. Ask what your doctor would do if they were in your position. And I mean really ask, not in a hypothetical way, but in a way that invites honesty. Because the truth is that many doctors, when faced with these decisions for themselves or their own loved ones, often choose less intervention, not more. They understand the limits of what medicine can do. They understand that quality of life sometimes matters more than quantity, and that pursuing every possible diagnosis can sometimes steal the very peace and comfort that make life worth living. There is a concept in medicine called overdiagnosis, and it is far more common than most people realize. Overdiagnosis happens when we find something through testing that looks abnormal, that gets labeled as a disease, but that would never have caused any symptoms or harm during a person's lifetime. We have seen this particularly with certain types of cancer, with thyroid nodules, with prostate issues in older men, with all sorts of findings that get discovered incidentally and then become the center of medical attention, even though they were never a real threat. And once something is found and labeled, it is very hard to ignore it. It is very hard to say, let us just watch this and do nothing, even when doing nothing might be the right choice. Our minds do not work that way. We want action. We want solutions. We want to feel like we are fighting. But sometimes the fight itself is what harms us. After many years as a doctor, I began to notice a pattern among my healthiest older patients, the ones who were thriving in their 70s and 80s and beyond. They were not necessarily the ones who had the most tests done or who saw the most specialists. They were the ones who had a clear sense of what mattered to them, who made decisions based on how they wanted to live, not just on fear of dying. They were the ones who asked questions, who pushed back gently when something did not make sense, who understood that their bodies were aging and that some discomfort and some changes were simply part of that process. They did not ignore serious symptoms, but they also did not panic over every ache or every borderline lab value. They had doctors who listened to them, who respected their wishes, who were willing to have hard conversations about goals and limits, and what kind of medical care actually aligned with the life they wanted to lead. One of the most important tests that often gets overused in older adults is imaging, particularly CT scans and MRIs. These are powerful tools, and they can absolutely be helpful when there is a specific symptom or concern that needs to be investigated. But they also find things. They find small nodules in the lungs, tiny cysts in the kidneys, spots on the liver, bulges in blood vessels, all sorts of things that might be completely harmless, but that create a cascade of follow-up tests and procedures and worry. I have seen patients sent for biopsy after biopsy because a scan found something small, only to discover that it was nothing, or that it was something so slow growing that it would never have mattered. And in the meantime, the patient has been through invasive procedures, has carried the weight of fear, has spent months in a state of medical limbo. This is not good care. This is what happens when we test without thinking carefully about the consequences. Another area where I see this play out is with cardiac testing. Stress tests, echocardiograms, calcium scores, angiograms. All of these can provide useful information in the right context, but they can also lead to interventions that carry real risk. Stents, surgeries, procedures that are hard on the body and that do not always lead to better outcomes, especially in people who do not have symptoms. If your heart is not giving you trouble, if you are not having chest pain or shortness of breath or other warning signs, then searching for problems that are not bothering you can sometimes do more harm than good. And I know that sounds counterintuitive. We have been taught that prevention means finding things early, that catching disease before it causes symptoms is the goal, but prevention is not the same as detection. Real prevention is about how you live, what you eat, how you move, how you manage stress, how you care for your body every single day. That is what keeps your heart healthy, not a test, not a procedure done to fix something that was not broken in the first place. Let me tell you what I think is the most important test you can do after 70. And it is not one that requires a lab or a machine. It is a test of your own body and your own awareness. Can you get up from a chair without using your hands? Can you walk a mile without feeling exhausted? Can you carry your groceries? Can you climb a flight of stairs? Can you stand on one leg for more than 10 seconds? These are functional tests, and they tell me more about your health and your future than almost any blood test or scan. Because what really determines how well you age is not the absence of disease markers, but the presence of strength, balance, endurance, and resilience. If you can move well, if you can take care of yourself, if you have energy and purpose, then you are doing far better than someone whose lab work looks perfect, but who cannot get through the day without struggle. I want you to think about this for a moment. What is the goal of all this testing? Is it to live longer, or is it to live better? Because those are not always the same thing. Living longer without quality, without independence, without the ability to do the things that bring you joy, is not a goal that most people would choose if they really thought about it. And yet so much of our medical system is built around adding years, even if those years are filled with medical appointments and procedures and side effects and limitations. I am not saying that length of life does not matter. Of course it does. But it should not be the only thing that matters, and it should not come at the expense of everything else. When you go to your doctor and a test is suggested, here is what I want you to ask. First, what are we looking for with this test? Second, if we find something, what will we do about it? Third, am I healthy enough, and do I want to undergo treatment if something is found? Fourth, what are the risks of the test itself, including the risk of finding something that leads to more testing or treatment that might not help me? And fifth, what happens if I choose not to do this test? Will it change my care? Will it change my symptoms? Or is this just information that might sit in my chart without leading to any meaningful action? These questions do not make you difficult. They make you informed. They make you a partner in your own care, which is exactly what you should be. There is also the question of how often certain tests should be done. Annual blood work has become a ritual for many people, something that happens every year without much thought about whether it is truly necessary. And while checking certain things periodically makes sense, especially if you have chronic conditions that need monitoring, doing the same panel of tests year after year when nothing ever changes and when you feel fine is not always useful. It is expensive, it takes time, and it can lead to false positives, to results that look abnormal simply because of lab error or normal variation. And then you are off on another round of testing to figure out what is going on. I have had patients whose lives were disrupted for weeks because of a single abnormal result that turned out to be nothing, just a blip, just the lab having an off day or the sample being handled incorrectly. But the worry was real. The time spent was real. The follow-up appointments and repeat tests were real. And none of it was necessary. I think one of the hardest things for people to accept as they age is that certainty is not always possible, and that trying to achieve certainty through endless testing can be a trap. We want to know exactly what is happening in our bodies. We want to have answers. We want to feel like we are in control. But the body is complex, and aging is not a disease that can be diagnosed and cured. It is a process, and part of that process involves letting go of the need to know everything, to fix everything, to monitor everything. That does not mean giving up. It means focusing your energy and attention on what actually makes a difference, on the habits and choices that support your health, rather than on the endless pursuit of data that might not change anything. I have also seen the toll that constant medical surveillance takes on people emotionally. When you are always waiting for the next test, always wondering if this will be the time something bad is found, it becomes hard to relax into your life. You start to see your body as a ticking time bomb rather than as the vessel that has carried you this far. You start to define yourself by your test results rather than by who you are and what you can still do. And that shift in perspective, that constant undercurrent of fear and vigilance, it wears you down. It makes you feel older than you are. It makes you forget that you are still here, still alive, still capable of joy and connection and purpose. Now, I want to be very clear that there are absolutely times when testing is important and necessary. If you have symptoms that are new or worsening, if something about your body has changed in a way that concerns you, then testing to figure out what is going on makes perfect sense. If you have a known condition that requires monitoring, like diabetes or heart disease or thyroid problems, then regular testing is part of managing that condition well. If you are considering a specific treatment or intervention, then testing to see if you are a good candidate or to establish a baseline is reasonable. What I am talking about is routine testing done simply because you have reached a certain age, testing that is not connected to any symptom or concern. Testing that happens on autopilot without any real thought about whether it serves you. The other piece of this that I think is important is understanding that guidelines are just that, guidelines. They are not mandates. They are not one size fits all. They are based on population data, on averages, on what tends to be true for most people most of the time. But you are not most people. You are you, and your doctor should be willing to talk with you about how those guidelines apply to your specific situation, about whether following them makes sense given your health, your values, your preferences. If a guideline says you should have a certain screening every year, but you have other health issues that are more pressing, or if the screening would be particularly burdensome for you, or if you have decided that you do not want aggressive treatment even if something is found, then maybe that screening is not the right choice for you, and that is okay. It is more than okay. It is your right to make that decision. I want to share something with you that I learned from one of my mentors early in my career. He told me that the best doctors are not the ones who order the most tests or who have the most answers. The best doctors are the ones who listen, who ask what matters to their patients, who are comfortable with uncertainty, and who are brave enough to sometimes do less rather than more. That advice stayed with me, and it has shaped how I practice medicine. I do not want to be the kind of doctor who just runs down a checklist, who orders tests because that is what the system expects, who treats numbers instead of people. I want to be the kind of doctor who sits down with you and asks what you are worried about, what you are hoping for, what kind of life you want to live, and then works with you to figure out what kind of medical care supports those goals. There is also something to be said for the wisdom that comes with age, the ability to distinguish between what is truly important and what is just noise. You have lived long enough to know your body, to know when something feels off, to know the difference between a minor ache and something that needs attention. Trust that knowledge. Trust your instincts. You do not need a test to tell you that you feel good or that something is wrong. Yes, there are things that happen silently, conditions that do not cause symptoms until they are advanced, and that is where some screening makes sense. But most of the time, your body will give you signals, and you are capable of recognizing them. You do not need to be in a constant state of medical surveillance to be healthy. You need to be paying attention, staying connected to your body, and seeking care when it makes sense, not just because a calendar says it is time. As I think about the patients I have cared for over the years, the ones who aged most gracefully were the ones who found a balance. They took care of themselves. They ate well, moved their bodies, stayed socially connected, kept their minds active. They went to the doctor when they needed to, but they did not live in the doctor's office. They did not define their health by lab values or scan results. They defined it by how they felt, by what they could do, by the richness of their daily lives. And when health challenges came, as they inevitably do, these patients faced them with clarity and courage. They made decisions that aligned with their values. They were not afraid to say no to treatments that did not make sense for them. They understood that aging with dignity sometimes means accepting limits, letting go of the idea that everything can be fixed, and focusing instead on comfort, quality, and peace. So here is what I want you to take away from this conversation. You are not obligated to have every test that is offered to you. You have the right to ask questions, to understand the purpose and the potential consequences, and to make decisions that reflect your own priorities and values. Your health is not just a collection of numbers and images. It is how you feel, how you function, how you experience your life. And the best way to protect your health as you age is not through endless testing, but through daily choices that support your strength, your resilience, and your well-being. Eat real food, move your body in ways that feel good, get enough sleep, stay connected to people you care about, find purpose and meaning in your days. These are the things that matter most. These are the things that no test can measure, but that determine everything about how you age. If you walk away from this remembering just one thing, let it be this: you are still the author of your own story. Your age does not take that away from you. You get to decide how much medical intervention you want, how much testing makes sense for you, and what kind of life you want to live in the years ahead. And a good doctor will support you in those decisions, will have honest conversations with you, will help you navigate the complexity without pushing you toward more than you need or want. That is the kind of care you deserve. That is the kind of care that honors who you are and all that you have lived through to get here. So the next time someone suggests a test, pause, ask the questions, think about what really matters to you, and then make the choice that feels right, not out of fear, but out of wisdom and self-respect and a deep understanding that your health belongs to you now and always.